I'm Hannah Fogarty.
Hi, nice to meet you.
Nice
Please
to meet you.
Okay, tell me, why did you go into nursing?
So, nursing was not my first career of choice. If you ask my mom when I was younger, all I wanted to be was be a mom. I wanted to have something to care for. I wanted a pet more than anything in the world. I went through way too many goldfish when I was younger. And then I got into nursing as I went through high school, and I took anatomy. And I thought it was like the most interesting class I had ever taken. And I think that really jump-started into my career choice. And also I was in art at the time in high school, and I thought I was going to be an artist, and then I realized maybe starving artist on the streets, so trying to sell artwork was not the way to go. So I kind of came here thinking, and came to Shenandoah thinking that I wanted to do nursing, and I don't regret a single decision I made coming into the nursing profession. I think it's a perfect fit for me. I fall more in love with it every day, and I think it's where I really was meant to be.
That's great. What clinical area are you interested in, and why?
I'm very interested in OB. I love dealing with babies. I love the experiences that moms have on labor and delivery. It's just such a special moment to capture someone coming into the world and to experience and try and be there to help allow them to have the experience that they would like to have.
Mm-hmm.
I think it's just a true blessing to be there and be part of that experience. So I really enjoy labor and delivery units, working with moms on postpartum mother-baby units, as well as dealing with sick infants in the NICU and other locations such as that.
Okay, well, that's very good. Okay, a patient is frustrated because she was kept waiting for a lab test. How would you handle that situation?
I think that's a situation where you need to explain and express to the patient why you're waiting for such an important lab test. You never want to send a patient home where they could be readmitted. And I think just stressing to a patient that here's the situation, we're looking out for your safety, for your health, and this is the best way is for us to have you here under observation and waiting for this to come back before we release you. And I think making it about safety kind of makes them realize how important it is.
That's good. What are your short-term and long-term goals?
Currently, my short-term goal, I'm a graduating senior from Shenandoah University's nursing school. My short-term goal is to just get a position, get a job, embrace being part of such an amazing profession, and to finally put an RN after my name. So that is my short-term goal. I would love to be on the specialty units such as labor and delivery or postpartum mother-baby NICU areas, but I really just want to dive in. I'm very excited about beginning my career. My long-term goals is I would like to go back and further my education. I seek a master's degree. I'm very interested in maybe going into midwifery or maybe even FNP programs. So I'm keeping my windows open and options open, but I definitely see myself going back to school.
That's good. What are your most remarkable skills?
My most remarkable skills, I think, is just me being such a people person.
Mm-hmm.
I love conversation. I'm one of those weird people in the elevator who asks you how your day is. I enjoy talking to people. I enjoy hearing stories, and I think that's why I enjoy nursing so much, because I get to meet different people every single day, and I get to see a little piece of their life, and I think it's just a wonderful experience, and I think it's a good skill to have is to be able to talk to anyone and just have that open communication skills.
Very good. What are your grades a good measure of your ability?
I believe that my grades are not the best depiction of how hard I've worked through nursing school. For example, patho, it was one of my first semesters as an actual nursing student. So not only was I dealing with a completely different set of knowledge, brand new to me, we also had a graduate professor who wasn't exactly teaching on our level. And we also had a grading scale change. So we went from a 10-point to a 7-point. So I had a lot of barriers and obstacles to get over that one semester. And I went into the final, and I was like right on the cusp of actually getting below a C. And I went in with the determination that I was going to pass, and I did. But looking at a C, you think that I slacked off. But no, that C, I worked harder for than some of my A's. And I think that's a clearer picture than just looking at a transcript to me.
That's very good. Tell me about your most memorable patient.
My most memorable patient is probably my first rotation ever. We started in a nursing home long care facility, and I was with the same patient for multiple weeks, and she was going downhill. She was by the time I got to her, probably the second day, she was almost completely nonverbal. She did cues, we gave her bed baths, and she would squeeze my hand. And I had her for I think it was 3 weeks. And then on the 4th week, I came back assuming I was going to have her, and I found out that she had passed away in the middle of the night right before I got there. And I think she was my most memorable patient because although we didn't have, I tell you I'm a talker, but we didn't have the communication. I didn't know much about her, but I just felt like I had a connection with her in a different way. And knowing that she passed away was something very early in nursing when I hadn't experienced much patient care to begin with. To have a patient who passed away, I think, was a big experience, and it left a mark on me.
Okay. How do you organize yourself for day-to-day activities?
I try and keep very scheduled. In classes, I schedule things between. So I go to class, I go to lunch, I go to class again, and then I plan on what I'm doing afterwards. So I'm very schedule-oriented. I like to make lists. I like to cross things out and feel like I'm accomplishing things.
Mm-hmm.
It's not enough for me just to be like, yeah, I did that, so I don't have to do it again. I actually like to physically cross things out. And yeah, so I just like to try and stay organized. I like to stay on a routine.
Okay.
But I kind of go off routine sometimes, but...
Okay, one more question.
Yes.
What kind of decisions are the most difficult for you to make?
Decisions that are very difficult to make, I think, for me personally, is for one situation that we've had lately in my preceptorship on the mother-baby unit, was a mom really wanted to breastfeed. And it was more of an ethical issue because she did come up in her pregnancy positive multiple times for numerous drugs. But the pediatrician decided that it was okay because when she came in, she was negative. Her urine screen was negative. So she said that we had to allow her to be able to breastfeed. We couldn't deny her the help and assistance to breastfeed. Although morally, I felt like that was wrong because she clearly did not care during pregnancy about using drugs. How am I going to send her home with the knowledge and skills to breastfeed when she really shouldn't be because she might go back to using drugs? So that was a very moral and just heart-wrenching decision, but then again, it wasn't necessarily my decision to make. We had to follow protocol, and if a mother comes in with a negative urine screen until the cord tox came back, it was policy. So I think it was a decision that sometimes following policy doesn't feel always right, but at the same time, it was a decision you had to continue with because it was policy. So I think that's something that maybe being on a committee in a hospital and working to use these committees and to change policy, I think would help a lot. So I think that drove me into another aspect of where I want to be.
Well, thank you for coming in today, and we'll be in touch.